stability desires or increased knowledge of the benefits of family planning or the availability of a choice of methods, we found that poor women will adopt a method. Across all 4 countries and very different city contexts within the countries, we did see increases in use and actually bigger increases in use among the urban poor. This pushes us to consider how we can address more broadly family planning in this variety of settings, particularly the poor settings. I would be remiss if I didn't also talk about another group that also struggles to get family planning and is particularly important in urban settings. I'm thinking of adolescents and youth. As we know, many countries in Sub-Saharan Africa and South Asia have large urban populations, but also the urban populations are also extremely young. Prior analyses have demonstrated that countries, not necessarily specific to urban areas, but countries that have more young people have higher adolescent birth rates. This means we need to keep these young people in mind. But also in urban areas, young people are more likely to be engaged in premarital or non-marital sex, particularly among young women, and these women and girls have family planning needs that are often ignored. These young people face significant barriers to family planning use and access to a full range of family planning methods. For example, they may visit a facility and be told they shouldn't be having sex, or they should get permission from a parent before they get a method, or there may be pressures if they're newly married to actually have a child before they start using family planning. Protecting these young people from unintended pregnancy is important to support them to attaining their fullest potential, which relates what Eliya, which we'll be talking about, the demographic dividend. Adolescents are an important priority now in the Family Planning 2020 agenda, but I encourage us to think about urban poor young people, and especially who may engage in higher risk behaviors to support themselves or their families. Again, this relates to poverty, food, schooling opportunities, gender equality, good health for all. That is, all of the SDGs become important when we think about young people at the cusp of life and living in poor urban settings. So I can talk about that in terms of the research side. I think Siddharth is going to talk about that in terms of the program side. Collecting data in urban areas, we want to make sure that we include everybody, and particularly in making sure we include the urban poor. I will say that we do have a harder time including hidden populations, or even in India, we talked about the sidewalk dwellers, that they're not included in any of our sampling frames, and so they tend not to be included in these types of studies. Although again, Siddharth will be talking about how you reach them, particularly for programming. But it is hard to collect data in urban areas, and we do have challenges, especially there's times when interviewers don't want to go into the slums, they don't feel safe. We have to encourage them, we have to make sure that, that the data collection process is representing the entire urban community. We've had times when we've had to fire data collectors because they've refused to go into some of these areas. I see nods from Joyce and others. But in terms of programmatic, I will leave that more towards the Siddharth side. But again, it does take making sure that they are part of your sampling frame, that is the group you're selecting from to be part of your study for research. If they're not part of it, then they definitely won't be represented. So considering strategies like some that Siddharth will talk about. In India, we had mapped the slums before we did our data collection to make sure that the slum areas were included, and then we oversampled those slum areas to make sure we had a large enough sample of slums.
Thank you very much. Can I ask Joyce now to come over there, if you like, and she's going to really give us a much more deeper look at doing the same sort of work in Kenya. Thank you.
Can y'all hear me?
Can y'all hear me?
Yes.
Well, I guess you do research, you don't use microphones, sorry. Ilene already talked about reasons why cities are attractive to many people. So I'm going to be talking a little bit about example of Nairobi slums. We do know there are over 900 million people living in places considered slums, Kenya typifies what we call the Sub-Saharan African urban crisis, with a significant proportion of its urban population living in informal settlements. Estimates put it at about between 60 and 70% of Nairobi residents living in slums or slum-like conditions. And these slum residents do exhibit significant disadvantages with respect to living conditions, morbidity, access to health services, including family planning, services, mortality, sexual violence, and risky sexual practices. And we do see that living in urban slums limits a woman's ability to control her fertility or implement her fertility preferences. For example, in the work we've done with the strengthening evidence for programming unintended pregnancy, we do find from our data in 2 slums in Nairobi that over 40% of pregnancies were reported as unintended. If we were to limit this to young people between the ages of 15 to 19, it was 51%. If we limit it again to those who were just sexually active, it was over 60%. We also do see that contraceptive discontinuation rates were high, with almost half of women who adopted a method during the postpartum period discontinued this method within 12 months. Unless followed by prompt method switching, this very high level of contraceptive discontinuation indicates that past contraceptive users account for a large fraction of unmet need for contraception among women living in urban slums. The Nairobi cross-sectional slum survey puts unmet need in the slums at 24% currently. But I think I should mention that Nairobi slums, that postpartum contraceptive use in Nairobi slums is considerably higher than national levels, estimated at 38% in the final 3 months of the first postpartum year. To this effect, we've seen substantial attention and resources invested in the past decade by the government of Kenya and its development partners to improve the health and economic conditions or outcomes in the country, especially among vulnerable populations like the urban poor and informal settlements. So for example, the Ministry of Health introduced a budget line for contraceptive commodities and made a policy shift on health service access. So what we call free treatment at public health facilities for under 5, slum-focused projects such as slum upgrading, cash transfers to elderly, free primary education, output-based approach voucher scheme, and free maternity care. This is just to name a few. And so what we do notice is that SRH outcomes among the urban poor is very critical, particularly because urban slums provide an expansive population, a fact which holds immense potential for making a large and much needed impact. Worth mentioning that family planning on its own, though, as a single intervention, will have minimal impacts on the health of women and children, especially in the urban poor. Existing research suggests that the integrated provision of family planning and other services, including maternal and child health services, has implications for not only poverty reduction in resource-poor settings, but significant declines in maternal and child mortality rates. So we do therefore know that, and it's widely accepted, that we need to take into account the complex, multiple and interacting factors that influence the well-being of people living in urban communities, especially when we're talking about SRH. However, we know that programs that work are not only intensive, but are expensive. On the other hand, those single sector approaches have value and place, especially in terms of advancing knowledge. They tend to be band-aids with limited possibilities for scale-up and not sustainable long-term. Yet what we see are funding cycles that still seem to favor single-pronged approaches with narrowly defined outcomes that are not sustainable. So the question to everyone here is, how can we then get governments and development partners and funders to buy into this notion that approaches that address the multiple determinants of health are better in terms of sustainability and scalability? Hopefully we get that answer as we get along. Thank you.
Thank you. Ahead in the game, and could you give us some insights on what would be the key elements that you'd like to see measured that you think would convince governments that this is the program that we'd like to upscale, number one? And number two, in looking at the service provision in these urban areas, it seems like the low-cost private sector is very, very dominant. So can you leave that out? How would you incorporate that in terms of public-private sharing? Would that help in promoting the scalability argument?
Okay, so I think the two questions are kind of related. And when we're talking about public-private partnership, I think it presents a unique opportunity that can be instrumental in helping government, funders, and development partners to maximize resources and effectively deliver quality services. One innovative way that we've seen in the research that we've conducted actually with the Step Up project is what it's called the total market approach. And this approach to providing quality and sustainable reproductive health services. And because public and private entities go in different direction and have different mandates, we have to agree. This approach, what it does is it identifies specific roles for public and the private sector so that they can collaboratively work in meeting the needs. So it takes several steps and it can go in different directions depending on the locality. It is, and I think Eliya has done a little bit of this, is engaging stakeholders, identifying who the vulnerable groups are, mapping and prioritizing the gaps and commodity needs within that specific community, and provision building capacity of these local providers in the public and in the private sector, and monitoring and evaluating to assess impact. And so what we do see is that if this approach is well implemented, it can hold government, especially at the local level, accountable and will provide available resources for services, quality provision of services and commodity.
Thank you very much. And I think a lot of questions might be directed towards you about what exactly is the total market approach. But I'd like to give the floor to Siddharth, Dr. Siddharth, to a more granular approach in India, Delhi, I think.
Thank you. It's a pleasure to be here and share some experience from South Asia. South Asia is home to about 600 million urban population and has 5 of the world's largest cities: Mumbai, Delhi, Kolkata, Dhaka, and Karachi. India's urban population has grown very rapidly. It's doubled between 1991 and 2011 and stands close to 500 million at this moment. The urban vulnerable or the urban poor represents the fastest growing segment of the populations of most South Asian countries. Probably Nepal is the least urbanized among the South Asian countries. Bangladesh is the most urbanized. I will now share 3 lessons which we have learned from practice and 1 recommendation. The first lesson is that if there are empowered slum women, they can promote education of girls and boys, which is what Ilene was also referring to, and Mumah was also referring to, the younger age group that needs more and more education and awareness so that they are able to avail these services. They also promote optimal age marriage and childbearing and awareness and accessibility of contraceptive services. The second lesson is that slum women's group members can promote the adoption of family planning practices. Now, why this is different from just promoting access and knowledge is that there is a fairly wide gap between knowledge and usage. So if we omit this little aspect of research, then we will just assume that all those who have knowledge or access, they are all using family planning, but that's not the case. The third lesson that we've learned is, which to some extent addresses the question, the program side of the question of how to find the most needy urban populations, is that spatial mapping of cities, it could be GIS, it could be hand-drawn maps. And why I'm saying both, because if we are looking at the cities in Sub-Saharan Africa and Asia, we should not expect municipalities to have GIS savvy workers in their teams. And because I've learned this from first-hand experience in many cities across the world, so I've come to realize that while some of the researchers are more keen to be more accurate, for the urban poor that is of no consequence actually. So it is better to use approaches where we do not produce a barrier between the person who's recommending the approach and the municipal body which has to implement it. Therefore, a hand-drawn spatial map, as used to be drawn by draftsmen, is still drawn by draftsmen in many cities across the world, can be equally helpful. The other type of mapping, which is another lesson linked to mapping, is participatory neighborhood mapping. So participatory neighborhood mapping helps identify specific families where you need input with respect to family planning and reproductive health, as well as other aspects of healthcare. For example, families which have girls aged 14 or 15 years. So here the specific input would be to continue education and postpone marriage, because in South Asia particularly, we still find that many parents wish to marry their girls early because they think it's a sort of a burden and a liability. We can also find newly married couples through these neighborhood mapping, and then those can be encouraged to adopt family planning, delay their first child, and also find families who have 3 or 4 children, and there the input specifically can be towards more permanent family planning methods. The recommendation that I'll share is that, which is very similar to what Mumah was saying, but it's just a little suggestion where, despite the fact that funders might have narrow programs, so if there's a program which is focused on family planning and reproductive health, the entity which is coordinating with the donor should try and broaden the scope of the program, so include family planning and reproductive health, but also include other things. But the donor might still want to call it a family planning and reproductive health program. So that is the tact that needs to be utilized, because donors have their departments, and the department heads have those narrow focus areas. So that's the challenge which will remain for a long time, because all donors are big bureaucracies. They will not change in very quick time. So this is a strong suggestion for programmers, researchers, that they utilize those resources so that they can broadly affect the well-being of urban disadvantaged groups. The small point about why I was using the word urban vulnerable or urban disadvantaged is that sometimes in research people go, when you use the word poor, they tend to go by a poverty definition, and then say, for example, in India, they have currently reduced the urban poverty by a new definition to less than 12%. It might actually not be anywhere close to that, but the governments tend to want to show their country as having eliminated poverty. So very soon they will say it is just 2%. But that doesn't really make any difference to the lives of the people living in those settlements. So we should really take these things very seriously and acknowledge that everybody wants to show themselves as doing good. So keep giving them a clap and then continuing the good work. Thank you.
Well, Siddharth, clearly you have years of experience in doing what we want to ideally accomplish. But how important is the local context, the national government? How do you go about getting that buy-in from the beginning? And I also had the privilege of hearing you talk, and those neighborhood maps as defined by people themselves and the involvement of the community is essential. But in terms of convincing the national government about where to locate services, etc., wouldn't you need more, just being provocative, wouldn't you need more hard data in order to convince them to put more money where it counts?
Thank you for that question. I've had the opportunity and the honor to actually have influenced the Indian government to introduce what is called the National Urban Health Mission now. Even though still it is in its very infant stage as regards to rolling out, but it's been drafted and is there. So with regards to involvement of the government at local, provincial and national levels, what we have learned is that we utilize existing government documents which have already expressed in some way or the other the need to focus on the urban disadvantage or the urban poor or the urban slums. They use different words, so it's the art of the person who's making this effort to pick out those words from existing documents. For example, there was a 10-year-old report by a committee which I utilized for the first time to prepare the first file to the note so that they could push that agenda forward and constitute a committee. The other thing is to have stakeholders involved at city and subnational or provincial levels through stakeholder consultation, so that from there the input feeds to the national government and it doesn't appear that the person like Siddharth is coming and telling us. The third important tact is that we should not issue any letters ourselves. Our role should be to get it signed by whoever is taking the lead in that particular setting. It could be a health department official, it could be a municipal department official, it could be an urban development secretary in the state, and likewise in the national level. So if I made the mistake of signing the first letter in the city, Dehradun, and the moment I realized that this was a big error, I did not sign even one letter subsequently, because it is their ownership. So I was typing the minutes of the meetings after the meeting, but the minutes were signed by the respective officer. So this is on how to encourage the government. The other thing which Zeba asked is about data. So we utilize census data and correlate it with other government data. So the important thing is for government to be involved, use government data in as tactful a way to make the point rather than use your own data. So then, because it is coming from some ministry or the other, so nobody will question that data. The third point is about the community. The community has to be heard. So if you go there with a listening approach, then there is a possibility that they will get mobilized. But when we go with a telling approach, today we have come to tell you about family planning. There you create the barrier of you being more knowledgeable and they being passive listeners. That is the big hamartia, as Aristotle said in the ancient times, that we often commit, and that is what has to be taken into account. And slowly, if you continue the listening approach, they will speak and take charge. Once they take charge, then you automatically realize that listening is better than telling.
Thank you very much. Words of wisdom here. Now we actually move to a different level and a different challenge, that is of convincing policymakers and also addressing the broader urban development agenda. We've all focused on family planning, and that continues to be our focus, but looking at other aspects of urban welfare. And over to you, Eliya.
Thanks, Zeba. And thanks everybody. I'll just start off by, I think, looking at some of the numbers that Zeba showed us. Basically, just to really understand the scale of the urban challenge or opportunity that we are looking at. I think if you look at Sub-Saharan Africa alone, right now, I mean, when you look at 43% of people living in urban areas, in terms of actual numbers, there are, 765 million people in rural and 588 million in urban areas. so that will change in 2035 when, around 2033, 35, when now more people will be living in urban areas than rural areas. But when you look at 2050, we are looking at 1.5 billion people in Sub-Saharan Africa alone living in urban areas compared to 1 billion living in rural areas. And I think as Zeba showed, the urban population will stop growing around that time, the rural population, and almost all the growth is going to be happening in urban areas. So what does this really mean for development in general? We know that the rural population is, the urban population is mostly dominated by young people. Actually, when we talk about this term, everybody has been talking about here the demographic dividend, where we are looking at the age structure that has more working people than dependent children. This is already happening in many urban settings where birth rates actually, even in Sub-Saharan Africa, are between 3 and 2. Exceptions, you see places like Addis Ababa where the fertility rate is even below replacement. So the issue is the future of Africa, South Asia, in terms of numbers, is going to be urban-based. What does that mean in terms of reproductive health, in terms of making sure that there's universal access to family planning? We all know that urban areas provide unique opportunities for service delivery because the populations, people tend to live close to each other. But there are also unique challenges, especially when you look at the examples we had from South Asia and Kenya, where most of the people are living in informal settlements, where service delivery is poor, people have very, very shaky livelihoods and so on. So how do we actually change the programming? How do policymakers look at this issue to make sure that actually as the birth rates are coming down, looking at taking at the increase in the urban population more as an advantage to really achieve universal access to family planning. So we all know urbanization has been a big driver of socioeconomic transformation and development in the emerging economies as well as many developed countries. But I think the Africa case, we still can't say with certainty how this is going to shape up because urbanization is urban areas are dominated by these poor settlements, informal settlements, and so on. So that's the first point I wanted to point out there, that at policy level, I think we need to understand that it's about the urban areas. The numbers are going to be there. It's an advantage in terms of service delivery if we can come up with unique sort of innovations that we've heard, like the Gates Foundation Urban Program has been working on in many countries in Africa and Asia, as well as some of the work that Sid talked about. But when we talk about really the extent to which our countries are going to take advantage of this big youthful population to be an engine for development, because the other side of the coin, of course, as we know, we had this experience in Northern Africa. Birth rates came down, high urbanized areas. You have all these young people who have been educated, but they don't have jobs and so on. If we are not looking at this more holistically, then there's a chance that countries can actually miss the boat. Instead of harnessing the demographic dividend, you see that you can actually face serious civil strife and so on. So I think I just want to highlight, I know we've all heard about the demographic dividend. We all talk about what opens the window of opportunity is actually to make sure that our birth rates come down. Birth rates are already coming down in urban areas, but especially among young people, we know that there are very, very high levels of teenage pregnancies. There's very, very high levels of unplanned fertility. So if you can actually take advantage of this urban advantage in service delivery and focus on addressing the high levels of teenage pregnancies and childbearing among adolescents and youth in general, I think the general sort of demographic fertility transition can be accelerated, getting fertility levels overall in these countries to come down and allow the countries actually to have that opportunity to harness the demographic dividend. So we have to reinforce service delivery focused on these poor people who are really marginalized, You look at the differences between poor slum settlements and non-slum settlements in places like Nairobi, very, very huge. The fertility about 1 and 1.5 children. You look at other services. So by closing that gap, I think it's going to provide an opportunity for countries to move forward faster. But the reason why African leaders and many people are interested in the whole concept of the demographic dividend is that we are not just talking about fertility decline for its own sake. It's because we are talking about that providing an opportunity for the countries to accelerate development. That's why the whole issue about skill development, education, and how do we create jobs for young people becomes important. Our organization, we recently did a study on the demographic dividend in Botswana, which is now predominantly urban. Botswana has invested a lot in education, but when you look at the national transfer accounts data, you see that young people are actually remaining dependent up to age 33. That's when they start producing a surplus. So we've typically looked at dependency as going to age 15 and so on. But because of the lack of capacity of these economies to create jobs, even in cases where birth rates come down, we've seen the cases of Tunisia, Botswana is one of them, even South Africa. It's very, very critical that we need to look at this issue from a holistic level where we say, okay, let's ensure universal access to family planning, eradicate all these teenage pregnancies, but we also have to provide opportunities for young people to make sure that they have good skills, they have education, and the private sector is being enabled to create more jobs. I'll end up by just saying, for me, working on demographic dividend in general, but I think it applies to looking at the urban setting. What are policymakers in Africa asking? They're saying we get the point. We really need to make these investments. But what they're asking mostly is, what should we do? How should we do it? How much is this going to cost? And I think a lot of our research, we tend to focus more on defining the problem, agenda setting, but I think the thinking among policymakers is shifting very, very quickly. And I think the examples we have, like from South Asia, the examples on actually how do we tackle these problems? How do we bring services in these urban settings to the poor, to those who are not able to get the services? I think that's what the policymakers, that's the evidence the policymakers are asking for. And I think if we focus on that, we're actually going to help, enable the urban settings in the developing world, galvanize and actually, drive the socioeconomic transformation that all these countries need. Thank you.
An advantage for everyone. And I think there are huge disadvantages for the poorest and the excluded. Can we do something in terms of policy, especially the window of the demographic dividend, if it only increases inequalities? I mean, all the opportunities are really for the more educated, the urban rich, etc. Can we actually think about arresting the rate of urbanization in these large areas, both South Asia and Sub-Saharan Africa, in order to reduce these inequalities? I mean, maybe intermediary towns encourage migration to them, or actually create opportunities in rural areas, because I can see that the best and the fittest will do well. They'll benefit from the demographic dividend, but it doesn't necessarily mean that everyone will reap the benefits.
Yeah, so Zeba, you're right that, the question about the urban advantage, it's really not an advantage for everybody. When you look at the statistics, the UN Habitat statistics, a lot of people question, whether they are really completely reflective of reality. But to say that in some of these African countries, 60%, 70% of people living in urban areas don't have the basic amenities that are typically associated with urban living, means that basically urbanization is not working for everybody. And so I think at the end of the day, if we really have to talk about achieving the SDGs, if we have to talk about reaping the demographic dividend, that push, the sort of a revolution has to start from urban areas. Urban areas have typically driven socioeconomic change. So if urban areas become spots of frustration, what we're going to see is more crime, more civil strife, and a lot of problems. So I think our countries need to pay particular attention to urban areas, but at the same time, understanding that in many of these countries, in many of our countries, birth rates are still higher in rural areas, and you can't overlook rural areas. But urban areas are the centers of big inequality. Look at Nairobi, one of the most unequal cities. A lot of wealth there, but also some of the most, the poorest, the poorest people or residences, you find them there. So I think not addressing this issue is actually likely to cause a direct conflict, because the poor one day will come up and there might be a nasty revolution and that sort of thing. So I think in terms of reproductive health, I think I look at the urban area really as a big advantage, because people are there. I think it's easy to come up with services and so on. But the other problems that actually counter progress in making sure that people access these services also operate more there, because young people are more desperate because of their livelihoods in the informal settlements. One study we did in Nairobi was showing that actually the youth in some settlements are 3 times more likely to start sex at an earlier age of what we're looking at, 15, I think another one at 18, than other kids there. So I think that's where now the issue of comprehensive sexuality and education and services need to come in more than even the other areas.
Thank you very much. Now, with this full room, and I think with this really rich set of panelists, I would really like to take this opportunity to ask a few questions. Let's take 3. Please tell us who you're addressing them to.
Services which the urban disadvantaged are availing in any event, whether it is schooling or private clinics, and that is true. I think what the panelists here were trying to suggest is that if governments or the entire country needs to take advantage of the fact that there is a larger population and increasingly growing population in urban areas, what is the responsibility of that country and how that country can best utilize this emerging situation. So I think we would all agree that there are private providers. I think Ilene's evaluation research has also shown that, and all of us have observed it in our work. So there is definitely that case, but governments also have a huge responsibility, and they are the ones who would eventually run the country or benefit economically or become an economic power over time.
Eliya, you're supposed to answer.
I think the issue about keeping people in urban, in rural areas, I mean, we have to think about the reason why people migrate. It's because of opportunities. So I think if the opportunities are concentrated in urban areas, we'll always see people migrating. But I should also maybe demystify one fact that a lot of people tend to think about when we think about urban growth, the growth of the urban population. I think there's a tendency for people to think, oh, it's a migration. I think some people who have analyzed this have come to the conclusion that actually in Sub-Saharan Africa, 60% of urban growth is due to natural increase in the urban areas. So it's the births that are there, because a lot of people in urban areas are still giving birth to more children than they want, even if total fertility rates are generally lower. So I think you have to deal with both places, and I think in terms of preventing urbanization, it's about opportunities. I think other countries, Joyce was just reminding me here that you look at Kenya. Kenya has devolved its governance system now and created 47 counties, 47 different governments. I think Nigeria is also a devolved system. I think these when you devolve development and you bring it closer to the people, that will likely create more opportunities for people to work in the rural areas. And also, I think one of the big problems we have in Africa is the low productivity of agriculture. So as more efforts are done to really address those issues, more people would rather live in the rural area than go and live in Kibera slum in Nairobi, which is really looks like a very, very nasty place to live in. So I think it has to be that balanced development approach. Thank you.
Joyce, would you like to answer the research question?
Oh, okay. So I guess depending on who you speak to, the gaps will probably be different, not different, or will vary. But my opinion, one particular gap we're seeing from the work we've done is work on very young adolescents, especially in the slums. So We do have small-scale studies that have been done among adolescents, usually between 15 to 19 and 20 to 24, but very few studies have been done on the very young adolescents, and large-scale studies. So if you're looking in terms of research questions, which approaches or innovative approaches that will improve the well-being of very young adolescents in urban areas, we do know that they're initiating sex earlier than their counterparts in non-slum areas, even in the urban sector. But there's not enough research in that particular area. There's several studies that are doing it now. There's a global early adolescence study. There's that Adolescent Girls Initiative that's being implemented by the Population Council. But there's still not enough studies for very young adolescents in urban areas.
So I was getting a clarification on whether you were specifically interested in adolescents or more generally. Right. Okay. Just checking. My first answer is that there is actually a lot of information more recently from the urban reproductive health sites. So there's 4 countries: Kenya, Nigeria, Senegal, and Uttar Pradesh, India. We have a lot of information from those sites where we collected a lot of data, and the data are available to others if you'd like to examine it. There's longitudinal data, there's cross-sectional data as well from households and facilities. But so there are other existing data sources, including some of the demographic surveillance sites that exist around the world that have done a lot. What I would say is that we do lack broader information from other countries and other urban areas, including towns. We don't have good information on towns. And as you think about where people are going, I don't think we can keep them out of the urban areas, but maybe they'll start with towns. The growth of towns is important, and we need to be doing some research around these towns. And then I'll also say that we do lack some information, like qualitative information about what these urban populations really themselves, or what they themselves think are their needs, and how to get them into, as you said, to the existing services. There are a lot of barriers to those. There are these existing private and public sector services, but there may be barriers to them getting there. It could be a language barrier because they've moved from a rural area and don't speak the language. It could be a cost barrier. It could be as I mentioned, for young people, it could be a barrier of being told you shouldn't be in this facility. So I think I answered a couple questions at the same time.
Eliya would like to take the same.
Yeah, I just wanted to note that apart from maybe the research gaps my colleagues have talked about, I think another critical gap is even application of the research that is already there in decision making. I think in the reproductive health arena, I think policymakers tend to just adopt policies or programs that somebody is ready to fund and so on. So you see a lot of governments saying let's do youth-friendly services. Or peer educators and so on. A lot of these approaches haven't really proven to be that effective, but a lot of money is going into them. So I think a lot of the research, as I said, I think policymakers are asking more questions on are really needing more implementation research. How do we address problems? And for those that are already there, I think we need better sort of ways of translating the evidence so that they understand what they can do in that context. So I think we need to broaden the concept of research really to include also the art of translating and promoting how this evidence gets used, especially on these non-high impact interventions already. If you see what is being done in many countries, there's very, very little reference to the actual evidence in determining what gets used.
You mentioned that I think the call for research actually from the IUSSP includes an element of that. I mean, that we want policy relevant research and for it to have an impact. So can I take another round of questions? Gentleman at the back.
Question about the role of climate change in getting people to migrate to urban areas. I don't have a specific information on that, but I think we know that one of the effects of climate change actually is destabilizing rural communities. There are a lot of communities that were settled in all these lowlands that get flooded so often. there are persistent droughts. So I think what climate change is doing is that it's exacerbating poverty and people's desperation for the people who depend on rain-fed agriculture mostly, but even those who are settled in these lowlands and so on. So I think it's a major factor. Somebody here might have maybe a particular study that has looked at the actual sort of impact that migration has played in terms of increasing urban migration. But I would think not only urban, I think rural to rural, because people are moving to other areas, running away from areas that are that are more vulnerable. So I think it's something I'll look up for and maybe see if there's a specific evidence. But I think when I talked about opportunity, I was just talking in general. I think that the reasons why people are going to urban areas, it's economic opportunity. There's also a lot of civil strife. I mean, you look at Nairobi, Isli is full of a lot of people from Somalia, and it's not, just opportunity. It's because of the civil strife. And when you go into the other countries, for the most part, people end up in urban areas and so on. So it's a whole collection of factors that actually force people to leave. I think the issue about engaging heads of state, I think you will recall that last year the African Union actually declared 2017 the theme for their summits, harnessing the demographic dividend through investments in youth. What that did was that it kind of forced every head of state in Africa to come and read a statement about what their commitment to the demographic dividend. So at that level, you can say that there's been some engagement, but I think to me, what the African Union did was very, very remarkable. This is a very conservative organization, and for them really to put a population issue as like at the center of its development agenda for last year was quite remarkable. But what ended out of that, I think, is the big question. I think for me, I would say I've challenged a lot of experts to say what the African Union did was to open a window of opportunity for us to go into the countries and engage them. But I think that engagement at country level has been very, very limited. And where it has happened, I think it stops at agenda setting, and the big questions policymakers are asking is, as I said, what should we do? How should we do it? What will it cost? And I think most of us are not in a position to answer those questions. Family planning, there are all these posted implementation plans that are being done. You go to education, the other sectors of DD, there's nothing that can speak to costing and so on. So I think the heads of state in every country I've worked, Botswana, whether it's Uganda, Zambia, any head of state who looks at this evidence says, yeah, this is really important. We should do something about it. And I think to me, I'm challenging all of us. I think what people are asking for is what guidance on now, like in Malawi, as a result of the study we did there, the demographic dividend was incorporated in the 5-year National Development Plan. But the question you still want to ask is, so what? What is that going to result to? As long, the moment you start, working with decision makers to let that influence how budgeting is being done and so on, to start shifting funds to the areas where they need to focus on, then it will all end at rhetoric level. Thank you.
Yeah, sure. I think the question is what issues FP can be integrated to, because we talked about integration. That's an interesting question, and I don't think there's a clear consensus, in my opinion, as to which issues specifically FP can be integrated to, but there are examples out there that have been done. So for example, in Nairobi, the free maternity care program, I think now includes provision of family planning. But when it initially started, that wasn't the case. The reproductive health voucher program, I think, was the same thing. When it initially started, it didn't have family planning, but that was identified as a need or a window of opportunity to reach women with this services at this critical time. So how it's been done and what's been integrated to is very important, and it's gonna vary by specific locations. I'm just giving you the Kenya example of what has been done. And I just wanted to mention a little bit about policymakers, and just it seems like the conversation has been quite macro level in terms of who you're reaching. So head of states and all the like, and I wonder where you put the community chiefs at the local level? Where do they come in terms of how you engage with local leaders at the community level? How do you reach individuals at the community level if you're not engaging with these local leaders as well? And I think that needs to be brought into the conversation. And not the heads of states are very important. We cannot minimize that in any way. But I think that needs to be brought into the conversation.
Thank you. And the urban healthy cities, I don't remember the name, but bringing in mayors seems to be an important area as well.
I have two questions. One is from you, but what are the other elements that can be included in family planning programs? It would of course depend on the courage of the entity that is implementing the program. So if the entity is tactful, courageous, and does not worry too much about what is the donor's perspective, then they would implement it in a bottom-up approach, as we call it, though I don't like the phrase bottom-up. So it would entail understanding from the community what their needs are. It would encompass all the needs that all of us have: food, water, shelter, toilets, everything. So there would be, and all aspects of health, all aspects of education. So it's just the natural need of a human being is there, just the same as you and me. There's nothing different. The other small point here is that if we invest in developing inherent capacity of the human beings in urban poor neighborhoods, that is definitely something which is fairly easy to negotiate with the donor. So you can say that it is capacity building for FP and RH, but human capacity cannot be built isolatedly for just one thing. For example, if somebody is learning arithmetic, you cannot just teach that child division. It is not possible. The person needs to know 2 plus 2 is equal to 4, and 4 divided by 2 is equal to 2. So that is how you tactfully are able to build another intervention which is not technical, but which addresses all aspects of life. And your question about the community, again, it depends from the entity which is there in the community. So our experience has told us in retrospect that ideally it would be in the best interest of a research project to involve the community even before the project, so that the team that will implement the project and the community have some understanding of what they're going to do. Otherwise they will spend more than a year to just understand. And funders are impatient people. They don't want long timelines. I mean, I think 5 to 6 years, which gets extended to 7 to 8, is probably the most or the longest that I have commonly heard. There would be rare cases where it is 10 or 15 years. But then often there would be just 3 or 4 years. So it is best that the implementing partner, whoever has been determined, partners with a field-based entity which is already in the community. That would be the best, because there the engagement will be best.
You're addressing the...
Yeah, the measurement issue, I think. So I think I understood the question as what are we measuring, how are we measuring slums, and that it varies. I think I want to take a step back and just say that we measure urban areas very differently. We don't really have a good definition of what urban is, so already we're in trouble. So some places measure urban from having a population of 2,000, some it's 50,000, some it's hundreds of thousands and millions. So urban already is a vague term. So now we try to think about what is slum. What does it mean to be informal settlement, slum, sort of poor areas. So I guess in my mind, the most important thing is that we define our terms when we're using it so that the stakeholders that we're working with know what we're talking about. And again, it can be different. I want to give the example, and Siddharth might correct me, but I remember from the earlier round of the DHS, I am in India, not this recent one, I don't know about this one, but in the earlier round, the sampling frame had indicated whether households were poor or not poor, and then they asked the interviewers to go in and make an assessment as well. And partly it's possible that the sampling frame was old and things had changed, but there was not a one-to-one correlation between what the interviewers observed when they went to collect data and what the sampling frame said. So again, that's a nice example of sort of measurement challenges with this. We have measured it depending on we used it very differently in different countries. We had identification of slum based on neighborhood characteristics in Senegal, where we used the UN Habitat 5 characteristics, and then we brought the neighborhood leaders and we had them define their neighborhoods and broke our sampling frame that way. In Kenya, they had already put it into their frame as formal or informal settlements. And then we look at the data and we see differences, of course. But as long as you have clear definitions, and then we can take our data and we can create in the urban areas the poverty measures, whether it's done with measures of consumption or whether it's done with what we do as asset measures, and we can still get very different measures. But again, it's really about defining your terms and making it clear how you're defining your poor and your non-poor areas.
Thank you. I'm being told that we have to leave the room in about 2 minutes, so I think Professor Cleland, one last question.
Ask Eliya an impossibly difficult question. Historically, urbanization has been driven by manufacturing. And historically, no country has escaped from poverty without going through a rapid growth of manufacturing. The central problem, it seems to me, of rapid urbanization in Sub-Saharan Africa is that it's taking place in the absence of a huge increase in manufacturing. So the impossibly difficult question to you, Eliya, can Africa somehow circumvent the historical mandate or necessity of a manufacturing phase and go straight to a service economy? Because if the answer to that is no, then the prospects for the urban poor are pretty grim.
Okay, so I think you're asking, maybe in summation, I would just say, yeah, John, that you are right, that industrialization has been the main job creator in the emerging economies in urban areas. I think your question about whether Africa can circumvent that, I think the answer has to be that Africa has to circumvent that, because I think the context has changed. I think when you look at the Asian tigers, this became a big issue, but now I don't see how Africa can really use that model to the extent that other countries have used it. So I think the job creation agenda, that's like the big elephant in the room for African demographic dividend, and I think a lot of people, I also believe that Africa has really to embrace more the IEC sort of revolution that is happening and go into more into the service sector, while also maybe building the industrialization from modernizing agriculture and so on, which is not happening that much. But I don't think it will be to the same level that the other countries actually benefited from.
I think we should give a round of applause to our wonderful panelists. They pointed out that this is a huge and exciting research agenda that policy makers really need to hear. They have an appetite for more research. I think combining the employment, opportunities questions with family planning and fertility would be clearly something that I think is definitely a way to go. I think that we've heard from the grassroots level, community level approaches, very, very important, but so the high level policy engagement. So I really encourage you again to, especially the younger people in the room, to apply for this research awards that the IUSSP is going to put out a call for in just, I think, a few months, and really take advantage of this wonderful opportunity to do more research and present us with exciting new findings for the next session, let's say, whenever it is. I think it's going to be next year, combined with the African Union Conference or something. So thank you all. Thanks.